Here I'm going to talk about different type of biases that is associated with clinical experiment. The first one I would like to talk about is selection bias, and it's when a selected sample of population is not representative of a general population. A classic example would be when pharmaceutical companies ask for volunteers. For instance, let's say that there is a new blood pressure medication and a pharmaceutical company asks for volunteers. So people who would be interested to take this blood pressure would be the ones that have uncontrolled blood pressure. And so when the effects are checked, then the results would be maybe more significant or less significant than what it should be. So the actual results are not representative of the general population. And so again, keep that in mind that this problem arises when asked for volunteers. The other type of bias is measurement bias, and the fact that the individual who's being studied knows that he's taking a specific medication makes him change his behavior. For instance, let's say that there is a person out there that has high blood pressure and starts taking a new blood pressure medication. Now, since he's taking his new blood pressure medication, he has high expectations from this drug, and at the same time, because of his knowledge of taking this blood pressure, he changes his behavior. So he starts exercising and eats healthier with less salty food, as a result of which blood pressure will significantly drop, while the effect may not be as significant related to the drug. And similar event is experimenter expectancy. So when the researcher knows that someone is taking a specific medication, then interpretation of the results may be affected. So for instance, let's say there's a new medication out there for reducing symptoms of Huntington disease, and the experimenter checks the symptoms by quantifying chorea in these individuals. Now, the fact that he knows some individuals are taking Huntington medications may make him see the chorea less significant, while the truth is otherwise. So the other name for experimenter expectancy is called Pygmalion effect. And the way I memorize it is that researchers that change their data are no better than pigs. And the other name for measurement bias, which is due to the behavior of the individuals that are being studied, is Hawthorne effect. So both measurement bias can be resolved by doing double-blinded studies. And so here, neither the experimenter nor people who are taking the medication know whether it's a placebo or the actual drug. The next type of bias I would like to talk about is the lead time bias, and it's an early detection of a disease that may affect the analysis of the results in terms of survival. So let's say that individuals that are detected with ovarian cancer usually die 5 years later. Now, there is this new test that will detect ovarian cancer about 10 years earlier, and so the investigators come up with the conclusion that by detecting the disease early, then the lifespan would be extended by 10 years. But the truth is otherwise, because ovarian cancer was present here as well, but it was detected too late, versus here it was detected too early, and thus there is a lead time bias associated with that. Another type of bias that we have there is late look bias. So let's say, for argument's sake, that there is a new Alzheimer medication, and the investigators want to test the effects after like 10 years, see how these individuals are doing. So they'll study 1,000 individuals with Alzheimer's disease, and 10 years later that they go back, it's too late, and already 90% of these patients are dead. So only 100 of them are out there. And these 100 were the ones that didn't have a significant Alzheimer. So once they check memory in these individuals, they come up with the conclusion that, oh, this drug had a great effect, and these individuals, their memory has been retained in the past 10 years. So this is an example of late look bias. It means like you've been too late, that so many of your sample has been lost, and thus your results can be inconclusive. Another type of bias is called recall bias, and this is associated with retrospective studies. So let's say individuals that have lung cancer, you want to find out what percentage of them were smoking. So you have to rely on their recall of their smoking habits. How many packs were they smoking? How many years ago they were smoking? So if an individual does not remember exact details, then that would be a recall bias. And then we have the confounding bias, where one factor may affect the outcome of the results, but you never know that that factor is present there, so you miss the actual cause and relationship. For instance, let's say that investigator wants to check the effects of drinking alcohol to developing pancreatic cancer. And he comes to the conclusion that 80% of the heavy alcohol drinkers develop pancreatic cancer. But the truth is that these individuals that are drinking alcohol heavily are also heavy smokers. And thus smoking is the main contributor to developing pancreatic cancer. And so this is an example of a confounding effect. So just to summarize what I explained here, selection bias is when the selected sample is not representative of a general population, and an example is when you pick volunteers for studying the effect of a drug. Measurement bias, individuals that are being studied change their behavior owing to the knowledge that they're being studied. And this is also known as a Hawthorne effect. For instance, an individual is taking a blood pressure medication, and then to improve his results, he's starting to exercise and eat healthier food. So there would be a measurement bias in this case. And then experimenter expectancy is that the researcher's perception of the outcome of the study changes how he obtains or analyzes the results. A good example would be Mendel, who is the father of genetics, and he has shown that when two heterozygous cross to each other, 1/4 of them would be homozygous XX, small x, and then the other one will show the same phenotype. So 1/4 versus 3/4. And then the results he has obtained was like something like crazy close to the actual theoretical value, like 1.0001 versus 2.9999. So these are the values that he has reported in his publications. And future experimenters actually repeated the same experiment with the same plants and the same number, but the results were never as accurate. So there is actually a rumor that Mendel might have changed the results by the fact that he knew that these results is what he was expecting. So this is also known as the experimenter bias or Pygmalion effect. Then we have the lead time bias. So let's say there is a new, let's say that we detect lung cancer usually 5 years before these patients die from that. So in 5 years they usually die. Now there is a new screening test that detects lung cancer about 10 years. And when experimenters check the survival in these individuals since the diagnosis till death, they come to the conclusion that by this new test of detecting early, the lifespan has been significantly improved in these individuals. But the truth is otherwise. It just has been detected earlier. While in here as well, the disease was also present, but it was detected too late. So this is an example of a lead time bias. Then late look bias is that you've been looking at the data too late, that the part of your population has been lost. For instance, you want to check the effects of a specific drug in cancer patients. The ones that have a severe cancer already die, and the ones that have a less aggressive course are alive. So if you analyze those data, you come up with the conclusion that our new drug is helping these individuals to cope better. But the truth is otherwise, because you've already lost a significant portion of your population. And then we have the recall bias. So when you're doing a retrospective study, you have to rely on the memory of these patients to gather information. And if they can't give you proper details, then that would be a recall bias. And finally, we have confounding effect, where hidden factors will affect the outcome of the results. A good example would be the effect of alcohol on developing pancreatic cancer. But the truth is that so many individuals that are heavy alcohol drinkers are also smokers. So smoking is a hidden factor here that is also contributing to the development of pancreatic cancer. So by not knowing there's a hidden factor here, you're overestimating the effects of alcohol in developing pancreatic cancer. And that concludes our discussion.